on this episode of A Tale of Two Hygienists.
So I really want the hygienist, the graduating hygienist, to feel like I'm walking this new grad life with them rather than almost that consulting feel like, well, this is what you have to do and this is your script and this is what you have to follow. No, I have been where you have been. I will walk the walk with you. You have to teach so that the students are going to pass the board. So there's so much more out there that I think they're not aware of as much as we would like them to be. And I think that's where continuing education comes in and really embracing the fact that learning doesn't start really until you graduate. The more support I think these new grads have, the more likely they are to stay in our field. And we need hygienists in the field, so they're our next generation. So we might as well mentor and put in the time and effort to help them.
Yeah, this is a tale, oh yeah, a tale of two hygienists. So there might be only one, bringing the best of dental knowledge, and we do it all with ease. We cover oral health and screening, and preventing gum disease. We're gonna do a lot of learning, and have a little bit of fun working at the dentist. A tale of two hygienists.
Welcome back, everyone, to another episode of A Tale of Two Hygienists, episode number 425. I'm your host, Andrew Johnston, and thank you so much for joining me today. Great episode today. We have Kim Augustus on, and we're talking about life after hygiene school. This is a really good episode, specifically for those ones that are graduating or recently graduated. But one of the things we talk about a little bit as well is that, it doesn't really matter how long we've been out. Well, there's still plenty of things for us to learn. And so even if you're a veteran listening to this episode, make sure you stay tuned, give it a listen, and then reach out to Kim if you have any thoughts or suggestions that she can kind of pass on to the next generation, because it's people like Kim and it's people that are, mentoring and doing this next wave that are going to help set the standard. Unfortunately, not all of the very best hygienists can be in every office. So we're going to need definitely some coaches and some trainers and some people like Kim and what she's got going on, really kind of like preaching the good word of being exceptional in our profession. So thank you, Kim, for joining us. Then next week, we have a pretty good episode that's been a long time coming. So Teeth Talk Girl is going to come on, Whitney. Whitney and I met a really long time ago, and we've been talking about doing a podcast for forever. Unfortunately, her life is just so busy with all the videos that she's making, and we just could never get our schedules to coordinate. And so we talk about just her incredible journey and what that looks like. And I don't know, sometimes this is like a little bit for me as I've said, but as we do this podcast, I'm always interested in content creation. Like, what's your motivation for doing what you do? Are you in it to be famous? Are you in it to help clinicians? Are you in it to help the everyday consumer? Or is there another reason why you're doing what you're doing? And so we kind of get to the bottom of that. And then she has a really cool new project, I think, that we can all be a part of, that she talks about kind of at the end. So I'm really excited for next week's episode as well. I'll save my update for RDH Under One Roof for maybe next week or the week after, but it is selling out fast, folks. So make sure you guys head over to RDH Under One Roof and register. Other than that, I have a couple more spots still on that dental mission trip. If you have the ability, I know it's coming up quick. It's next month. But if you are just in a spot where you need a change, you're suffering from burnout, and you're like, hey, I need to, just do something new, come with me to the Philippines. It's super inexpensive. It'll be a great trip. There's a lot of great people going already, and you'll just be able to get recharged and re-energized. Reach out to me, Andrew, at A Tale of Two Hygienist, if you're interested in doing that. And with that, enjoy the episode with Kim.
A tale of two hygienists.
So just as funny enough, before we got on, I've seen little clips of your guys' podcast in the past, right? Gears and Tina's.
Oh, yeah. Yeah.
And so I went back and I was like, okay, well, I want to make sure I don't cover the same stuff that you guys are already doing. So I was looking as I watched the Cool Kids Club one. Oh my gosh. I just actually on Friday released an episode kind of along the lines of more to influencer and kind of how people have kind of changed their behaviors over time. But that Cool Kids Club is a very interesting thing. And I'm like, how do you join the fun, but stay out of the accusations of being in the cool kids club, right?
Right. Or the drama that comes along with it,
Why is there so much drama?
There's drama everywhere. And I don't know, is it because it's predominantly women, right? So even
That
I
can't be
work,
right. Well, I mean, I understand like that's the working theory. There are just as many like prima donna men.
I know.
If you really get down into like the granular part of it, it's just a lot. I mean, in our profession, it gets stomped out. Like you don't see it as much.
Right. Unless you're really in tune to it and then you notice it.
Right.
And the more like events you attend, the more like I just had after dental hygiene seminars, like I had dinner with and even is like I could be out with a whole bunch of people or all this stuff. She's like, but I don't want to do that because you never know what's gonna come out as something. She's like, just because you see me in a picture with somebody doesn't mean we're all buddy,
And that's the interesting thing. I think there are several people. This is actually a really good conversation. Do you mind if we keep part of this and we'll bleep out the names? Is that okay?
Yeah, bleep out names.
We'll bleep out names, but this is like, I mean, we're going to get into this podcast here in just a minute, probably not, and I'll determine if we're going to keep this or not. But like,
yeah,
that's a good point though, because I was just showing my kids. It's weird how like more introverted I become the longer I do the podcast, right? So this is year number 8, I think now. At first, I was like, hey, come up to me, give me a hug, do all this stuff. This is all obviously pre-COVID too, but like, give me a hug. We're going to hang out. Like, I just want to see you. I want to meet you. And now I'm like, wave to me as you walk by the booth, like say hello, but don't come all that close. But I was just talking to my kids and they were talking about the influencer episode. And I said, hey, tell me more about this stuff. And they said, well, Dad, like, you do stuff in dentistry. I'm like, yeah, but look at my personal Facebook. I've had 4 posts in the last, I think 9 months. Total. They're like, yeah, what about your Instagram? I'm like, 0 posts ever, I think. Maybe 3 total in the history of Instagram. And so when we're looking, I kept seeing like, I said, that's not me. I didn't post that. I was tagged in. I didn't post I was tagged in that. So this other person that you're talking about is exactly right, where it's like, sometimes these really famous people, and not me, I'm not even on the same level as the person you mentioned, but like these people get used for their name and for their, face and whatever, so that you are quote unquote in that cool kids club. And that's bizarre to me.
Yeah. And the quote unquote cool kids club too can turn nasty really fast. And that's some of what I've seen too. And I'm happy in my little pond. I don't need to be in the big ocean with everybody.
Man.
I can be in the backyard, ankle deep pond and happy.
Do you feel like, I mean, this is just maybe my observations a little bit skewed, but don't you feel like most of those groups that turn nasty didn't start nasty though? Like, weren't they like maybe the outcasts, but not, maybe not even the outcasts, maybe they're just like nice friends to each other and they just found themselves and then all of a sudden they morphed into this thing.
Right. And it can be stress. And I do think it's everywhere, right? I mean, it's in the workplace. It's in big groups. It's everywhere. And it's really how you position yourself, I guess. And it's very easy to get sucked into it. And I definitely noticed that.
I love talking about dental hygiene stuff. Isn't it fun?
It's awesome. It's so fun.
All right. Well, I'll do a real intro. We might just keep all this in with the bleep names and all that, but we might not. We'll see what happens. So, okay, we have to get into this episode. Everyone welcome in, or maybe welcome in 8 minutes ago when we started this conversation. I'm joined by Kim Augustus today. Kim, I really would like, you were on a tip episode, I think was what got released before this episode is going to be released, but I'd really like to go a little bit deeper into your personal history, Bloom RDH, go into the history of that, kind of what you're doing out there in the world of dental hygiene.
Yeah, absolutely. Thanks for having me. It's great to be here. So I have been a practicing hygienist for over 10 years. I've worked in education for 8 years. And I was that really good student. I was top of my class. I was great clinically. I was really good academically. And I got into the real world and I really self-imploded on myself. I had no idea what I was doing, or felt like I had no idea what I was doing. I felt alone. I was walking into an office with 45-minute appointments, the doctor yelling at me. I had no idea that this is what the real world was like. As I got into education and I started hearing back from my students that were kind of saying the same thing, like, I don't feel prepared, I'm so nervous, that I really found there was a lack of mentorship after graduation. And that's really where my passion came from, is because I now feel like I have walked that road and I feel so much more secure than I did as a new grad, obviously. But if I can instill a little bit of the knowledge that I have now and help those students after they graduate, then they don't have to go through the pain and suffering that I feel I had to go through.
Talk a little bit more about Bloom RDH. This obviously has to go with the mentoring side of it. Like, you wanted to be able to give back. Tell me about the organization and what you're doing.
So I mainly have like an on-demand program that you can purchase that really picks up right from where school leaves off. So it goes into, creating your resume, interviewing for a job shadowing, and then what happens once you're in the office. So how do you really establish yourself as a coworker? How do you establish yourself as a clinician? How do you interact with your doctor? So it really picks up those pieces after that. I also love speaking with schools and speaking with students that are about to graduate, answering their questions, letting them know who I am, and that they can always reach out if they need to. That's pretty much where my business is at, while also trying to work full-time in education. I'm still trying to find where those extra 12 hours are a day to get everything done that I want.
Yeah, when you find it, let me know. It's not something
right?
that it's everyone that's burning the candle at both ends, picking up 3 or 4 different jobs. None of us have it figured out. I promise you that. So let me talk about that though, just because hopefully our listeners, I feel like our listeners heard you like, I was a great student, and they're like, click, we're not going to listen to the rest of this person anymore. She has no idea what it's like.
Right?
But
Right?
I want to talk about
I do.
if they would have hang on and like see how you self-imploded, that's going to
Right?
catch them.
Yeah.
I want to talk a little bit about like this mentorship thing, because I feel like there have been lots of organizations that have tried this in the past. I remember, it was probably maybe 3 or 4 years after graduation, I would get an email, and I can't remember if it was from, the ADHA or if it was from a different organization. I think RDH Magazine at one time was sort of trying to do something like that as well. But they were trying to partner up like mentors and mentees. And inevitably, I don't want to say they've all failed, because I stopped hearing about them. But what are you doing that's going to be different? Like, how are you going to make sure that this kind of mentorship thing isn't a short-lived experiment, so to speak?
So I really want the graduating hygienist, to feel like I'm walking this new grad life with them, rather than almost that consulting feel like, well, this is what you have to do, and this is your script, and this is what you have to follow. No,
Yeah.
I have been where you have been. I will walk the walk with you. I also offer one-on-one coaching, which I'm doing as well with a few new grads, where I really go and dive into what problems are you facing right now, and how do we come to the other side of that. So it's not so much, hey, this is what I did and this is what worked, but let me walk alongside you and let me go through what you're going through, and let's come to a solution together so that you can feel fulfilled in your career. Avoid that word that we're hearing all over the place of burnout, but really keeping that passion alive right out of the gate as to why you got into this career. Recently, even I heard from a couple of my own new grads that have said, it's just not what I thought it would be. And
Interesting.
isn't it? Because I can, they're not really happy with the offices that they're at. And that's really where you have to stop and think is the right office out there? How do you find it? But what is it that you're not liking? Because I think hygiene can be very redundant, right? We're doing the same thing. But how do you keep that alive? Are you learning? Are you growing? Are you in an office that's supporting your growth, that's learning together to elevate patient care? Or are you just kind of staying stagnant and not thinking it's what you thought it was going to be?
But how do you not know? I mean, I guess I'm a bad example of this. I didn't really know what I was doing before I got it. I'd be like, we're going to dental hygiene. I got a license.
right?
I wasn't
Here
sure
we
what I was
go.
going to get I'm doing. But luckily for me, I think in my state, we were able to do lots of different things, not just like scaling, right? So how do they just not know that that's what the job is, though? That's all what school is. And they must have asked questions before going into the program a little bit.
You would think, but at the same time, I don't know. And I really think it has to do with workplace and not enjoying where you're working, or not enjoying your coworkers, or not, you and the doctor on the same page as a team. That I think makes a great difference. When you and your doctor are on the same team, you can predict what they're going to say before they walk in the room. You have your hygienist next door that knows You know exactly what you need if you need something, and you work as a well-oiled machine. I think the days are so much more enjoyable than going into work and feeling like you're just alone in your operatory all day.
How much of this is like a generational thing? So I keep hearing from the people that are before us, like older than us and more experienced, whatever you want to call it, longer tenured, old hygienists. I keep hearing from old hygienists how that the youngins, they're in this TikTok era, they're in the fast instant gratification, and they don't have the attention span to go ahead and do this quote unquote monotonous job that we have as dental professionals. How much credence do you give to that kind of statement or that thought?
I think there's a lot that goes behind that thought, because the generation now, like it's different. I see it in my students that come in every year, and I'm for lack of a better word, sometimes I'm shocked at what the newer generation is like. I think some of them will be fine in, your clinical hygiene job, but also I think it's important to know what else you can do with your degree, that you don't have to just do clinical hygiene, or you can split it up between a few different part-time things so that you're not falling into that routine of redundancy.
Do you feel like the education that you all are giving, and then like the current curricula compared to where you were when you graduated and me when I graduated, do you feel like it is encompassing like the bigger oral systemic? There's more things to do during your hygiene appointments as opposed to scaling or replanning, or is it kind of the same? Because that's where I think people can grow into, is there's so much more we do chair side other than what we're given.
I don't think that's going to change until the CODA standards change, because you have to teach certain things to be an accredited school, and you have to teach to the boards, right? You have to teach so that the students are going to pass the boards. So there's so much more out there that I think they're not aware of as much as we would like them to be. And I think that's where continuing education comes in, and really embracing the fact that learning doesn't start really until you graduate. We're here to lay the foundation, give you the basics to get yourself your degree and pass, but then the learning takes off from there. And where do you want to go? And what are you passionate about?
I should be great. There was, I don't know if that's something you're moving into, but also maybe a listener being like, you know what, it might be really good to do like school presentations and say, hey, if you're getting bored by year 2, remember this presentation. Here are all the things that you're not doing. I promise you're not doing them if you're bored, because you could be doing these things. And then also, if you talk to your doctor and get the, the buy-in, and then obviously no one likes talking about production, but production's going to ramp up, but you'll be more fulfilled, still chair side. And then also you have a greater understanding of the business of stuff. So then you can move into the next step, maybe 5 years after that, if you get bored again. We're tangenting onto the whole thing, but like that is maybe a good business idea for somebody. So I want to know about advice that you were given, advice that's being given now, because I think we've all received some pretty bad advice coming out of school, and I hear less and less bad advice being given. But do you feel like maybe the new grads are being told something, not in the educational setting, but like maybe from CEs or influencers or anything like that? What is going on there?
I hope not really in that sense. I think it's where you end up in your workplace, because you can come in as the new grad and you can come in, right? We always say, look for the office that has those long-term employees. Those employees that have been there for a long time are is a good sign that you're getting into a good practice. However, if everybody else has been there for a long time and you're all of a sudden this new grad coming in with all this wealth of knowledge, and I want to do this and we should do this and this and this, you may get negative feedback from the other hygienists that are there that, well, we don't need to do that. And, oh, that's just what they have to teach you in school. And that, I think, can be discouraging to a new grad, as opposed to an office. This is a whole other topic too, but the DSO versus the private practice, right? Could a DSO be more in tune with a new grad, or be able to offer more resources to get that new grad up and running, to give them that chair-side mentorship that they need, and are more aware of what's out there or what is trending, so that new grad can feel like they're bringing in what they learned in school and are also supported with the knowledge that they have brought in.
No, absolutely. I would love to have that conversation at some point. Obviously, I'm very pro DSO, so like we can have that on part 2 of this.
And I am neither way, right? There are great DSOs, there are great private practice, there are not great DSOs, and there are not great private practice. So it's just,
Amen.
yeah, it's where you feel comfortable.
Amen. Yeah, I love that a lot. Can we drive head on into this conversation about pay and compensation?
Yeah, because that's always a big question I always get.
It is, and I know that you do. And so here's my Andrew, the veteran hygienist, cranky pants Andrew version of it. I don't understand how you're a new grad, and I know what your skill level is as a new grad, and you're going to demand $65 an hour. And I don't understand how you can competently feel good about that. So
Right.
tell me why I'm wrong.
I would love to know the ins and outs as to why this is happening. But also, doctors are paying that. They're getting that, some of these new grads that are walking out and demanding that, as opposed to your hygiene. And I get, there's a lot of people out there that say, we're all licensed, we're all professionals, but there is a skill level that comes with it, right? I can tell you that when I graduated and I worked for that doctor that made me cry all the time, I was leaving calculus all over the place. He came in, he checked all the teeth on my patient. I cried, he yelled. It was a very love-hate relationship, but it made me so much of a better hygienist because I checked every patient after that. I made sure that calculus was off. I learned how to use instruments in ways probably they shouldn't even be used just to get that calculus off. But not only that, but it made my skills better so that I can go out there and feel good about asking for that higher dollar amount when I went to go for a new job. I had the skills, I had the confidence, it was there. As a new grad, I think you have to realize that you might not get top dollar. Not only might you not get top dollar, and I think I talked about this at one point too, is there's so much more that goes into dollar amount, right? And for me, I can tell you that I'm probably a very low paid hygienist in the grand scheme of things because I was happy with where I worked. I was happy with my coworkers. I'm okay with taking a lower dollar amount for that good office environment as opposed to going in somewhere and demanding that high dollar amount and then getting worked into the ground or hating my career because there's so many more high expectations.
Yeah.
What are your thoughts?
I mean, it's very similar. I think it's very similar. I really wish that there was, and I don't want to get into the conversation of having like a union or something like that, but there really does have to be like, you are out this many years. This is your max. Like you can't, and I understand that it has to be broken down by region, geographics, and all this other stuff. And that's what makes it too complicated and really not feasible to do. However, there really does have to be, good, better, best, on a pay scale. There has to be good, better, best for every like location. But then also you don't get paid the best if you're only doing prophies and scaling and root planing. I'm so sorry. If you're not doing oral cancer screenings and all the extra, if you have extra functions in your state, if you're not doing all of that, you don't get the best.
Right.
And so I'm so sorry, but your speed is also something that has to be taken into account. Patient satisfaction. I'm huge about patient satisfaction. Should be definitely taken into account. Are we giving surveys to our patients on how their appointment was? And then you compare that with also health levels, right? Because you can't just have like the polished person who's like, I'm just making everybody happy because I'm just polishing, not hurting them, because they're going to get great scores, right? But then the other person who's doing real peritherapy after this other person is like getting all these bad scores. But then you have to look at, so if you take health and that, anyways, again, tangenting too much, but there is not, I don't think it's fair. And I think it's actually hurting the profession having new grads demand that much. Now, if they just take whatever the offer is on the table, that's a different conversation. That's not what I'm saying at all. But I've heard people coach to, no, you demand this much, you are worth this much. It's like, you don't know. So I have another kind of controversial thing. Not that I always want to talk about controversial things, but I just feel like that's like a more fun conversation to have, because this question was asked to us years ago. But I noticed that you and Tina cover on your podcast, there was a topic about loops and lights.
Yes.
I didn't get a chance to listen to it yet, so I don't actually know where you are on this. But I feel like the RDH world, and also the feedback that we got on one of our episodes, it's kind of divided, because loops and light don't help you see subgingivally. They don't help you see bacteria, but it does help you see things like stain or maybe smaller local irritating factors that are less likely to impact the overall health of the patient, but are still what we consider like what we're supposed to be doing as hygienists is remove all the stain, do all these things. So where do you stand on this kind of semi-controversial topic of loops and light?
Let me ask you, do you wear loops and light when you practice?
I do restorative. So I started to at the end.
At the end, okay.
Yep.
So I got loops and a light right in school. After pre-clinic, I think it was my second year of school, I got loops. When I graduated, I got a light. The light, I think, is really, for me, the most important part, because that overhead light, it's not bright enough. Your head gets in the way. You're looking at a black hole in there. The light really lets me see what I'm doing and where I'm going. And the loops, at this point in my career, I can't see without them. I mean, could I do my job? Of course I could, but it really makes a difference for me to have loops and a light, especially looking at the probe or anything like that. Is it mandatory or necessary? No, you can get by. Hygienists got by for how many years without them? It's something I go back and forth on, because we just went through this in my school. Do we make it mandatory for the students or do we not? And we ended up not making it mandatory for them and leaving it up to them to decide. But a lot of schools are requiring loops by the end of pre-clinic.
And that's what I've noticed as well, is like I feel like we're moving into that as a profession. I think where I would come down on it, you're absolutely right about the light. By the way, I don't know if this is not true at all. So listeners, I'm lying about this, but I'm wondering if like bald spots happen sometimes because of the overhead light.
Right?
I don't know how many dentists are bald in that exact same spot because of this thing. Anyways, I wonder, I do wonder if like there is definitely, I mean, I know that there's definitely a benefit to having that, the loop lights.
Mm-hmm.
Where I also think that we are moving into, and I don't have any of these, so I don't have firsthand experience, but like the ergo loops, right? So the ones that are meant for posture, and you talked about, all these hygienists have been doing it for years, but yeah, look at their posture. Like they're out of it early because their back and their neck and their shoulders and everything's like all jacked up because they didn't have good posture because they're just getting so darn close to those patients. I started without loops. We had loops in our school, but they made me nauseous. I couldn't do it. I have eye issues anyways, but like they made me nauseous. And so I never used them. I got really good without it. And then, was I probably closer than other people to the people's faces? Maybe, looking back on it, but I don't know. At the moment, I didn't care or know.
Right.
But I think that there's, the arguments may be a little bit faulty on like, you can't see like bacteria or whatever, but it's like, but that's not exactly the only reason why to use loops. But
right, exactly. I was just going to say about loops too is, the ergo loops. I haven't tried them. I hear people love them. I do have some students that just purchased the ergo loops that are going to be now using them in clinic too. But I almost struggle with how to teach somebody using ergo loops because I've never used them, or how they should. But their posture looks great, but they still, in second semester, you're still having to remind them about clock positioning and things like that. And that's where I get a little lost with the ergo loops too.
That actually is really good. I was going to ask about that, how strict you are going to be about clock positions, because I would imagine it's got to be somewhat similar, but also we just adapt a little bit different. And then also, getting out of like the proper way of doing it back in the real world, right. where does that actually change as well? Because I mean, I was a stander for all my years of practicing and kind of walked both sides of the patient and
really
could see whatever I needed. Yeah. It was so much better. I'm not tall, but I'm 6'1", and it was really nice to be able to like stand most of the day as opposed to like sitting and like leaning over and doing all this stuff, which is probably why I don't have as many like, issues as many hygienists do. All right. I have another one for you that you may or may not know this one. Do you like how we didn't prepare any of these, by the way?
Yeah, this is great. Let's hear it.
Okay. So what's something that you're seeing in the new grads as like a pretty major deficiency, but not just isolated, like, it also happens to the veteran? Like where are we all kind of screwing up?
That's a good one. I mean, in the new grad, I would say confidence, and that I think you can even carry for 5 years into your career.
Or 20.
Yeah, I was just going to say, I think I still have some days where it's like, oh my God, did I say the right thing? Is that right? I think that's a big issue. But again, the confidence comes in time. And that's where a new grad struggles with, when am I gonna feel comfortable And really, I think it took me like 5 years before I really felt confident walking into that operatory and knowing the right thing to say. But that all comes in time. But anything really crazy or concerning, I don't know.
Well, it's funny because like to me that is crazy and concerning. That confidence is one of those things. I don't know if we actually bleeped this out. We were talking about maybe bleeping parts of it out, but there was we talked about was it like with a predominantly female profession, women tend to not really be as confident in themselves, and I think that is a trait I see in a lot of our coworkers.
Mm-hmm.
And I look at them, I'm like, you are good at this. Like you can, I go behind you and see your patients, like, and you see my patients, like we're on the same level. I mean, I'm not any better than you. You're not any better than me. I mean, we both miss stuff. We both excel at stuff. Like we're the same. And you're right. I don't think that people ever get coached or trained or taught or instructed or whatever on confidence. I would love people to be a lot more confident. And, you're going into kind of a newer space a little bit, and I'm sure you weren't the most confident then, but the more that you learn and the more you interact with people, the more confident you get. And you're right. I think it's just something in time that happens, but I think we also need to have somebody in our corner. Because without somebody in our corner, we won't know.
Yeah, exactly. I hired a coach to help me with that because confidence, especially going into this business alone, I lacked all of the confidence. And she really walked me every step of the way weekly on how to, and really we're all insecure on the inside, right? We all judge ourselves the hardest, that really nobody else cares, and if they do, then they're probably lacking the confidence in themselves. But it has helped me to work with someone on that confidence piece. And I think that's another reason why I love giving back to these new grads, is because they know more than they think they do. And you just have to be confident in your skills and yourself, and it's all going to fall into place.
Absolutely. All right, you ready for the last question?
Yeah. Then is it I get to ask the questions?
No, that's maybe for part 5 or something. Then I'll let you ask questions. All right, so here's my question for you. The veteran established hygienist really does struggle. We talked about this earlier in the podcast. They really do struggle with some of these new grads. What's a piece of advice that you have for them so that when inevitably they encounter someone that's either new or recent grad, the friction is lessened? It's not going to be probably gone, but like, how can we lessen that as veterans?
I think just supporting the new grad and asking them, how are you doing? Do you need anything? A lot of people I've talked to have had that hygienist that's really taken them under their wing in their office. And those people are so lucky, because then I hear the exact opposite, where nobody helps them and they're really isolated and alone. So I think just having that conversation with the new grad, getting to know them and where they might be struggling, or offer advice and help, check in with them. Hey, how did your week go? Did anything come up that you really weren't unsure of, or anything that I can help you with? Write it down. Let's find some time to meet and discuss in the lunchroom over lunch. The more support I think these new grads have, the more likely they are to stay in our fields. And we need hygienists in the field. So they're our next generation. So we might as well mentor and put in the time and effort to help them.
I love it. So if you are listening to this episode and you are a student, make sure you reach out to Kim. If you're a new or recent grad and you have, maybe the confidence issue or maybe some other issues you're trying to work through, reach out to Kim. If you're a veteran hygienist and you have a new or recent grad in your office, talk to them so they can reach out to Kim. There's so many people that I think they can benefit from you, Kim, but how can they find you?
So I try to be really active on social media. So on Instagram, it's bloomrdh. My email address is also bloomrdh@gmail.com. I'm always open. Even if you just have a question, don't hesitate to reach out. I will always respond. I will give the best advice that I can, but always know that I'm there to support you.
Kim, thanks very much for being on.
Thanks for having me.
Yeah, this is a tale, oh yeah, a tale of two hygienists. So there might be only one, bringing the best of dental knowledge, and we do it all with ease. We cover oral health and screening, and preventing gum disease. We're gonna do a lot of learning, and have a little bit of fun working at the dentist. A tale of two hygienists.